Heart disease in America is epidemic. The last statistics I've saw from the CDC, they said 45% of U.S. adults have uncontrolled high blood pressure. This includes 37 million adults, which and additionally, it's around 19 million who should be taking medication for hypertension are not taking it because they just don't know it. What is your understanding of heart disease in America?
The biggest thing that I'm seeing is that linking to hypertension, it's also known as.
Hey everyone, this is Theo Harvey. I'm back again with another great medical innovator. I'm here with Dr. Emmanuel Isang, and we're going to go into details around hypertension and heart health and how it can help you grow not only your medical practice, but help your patients get better for the future. So Dr. Isang, welcome to the podcast today.
Thank you. How are you doing?
I'm doing wonderful. So if you don't know Dr. Emmanuel Isang, he's doing a wonderful work out there on the internet and Instagram. He's over 7,000 Instagram followers. He's on YouTube, around 3,500 subscribers. He does a great work about communicating the value of health, as well as helping you guide your patients through the journey of just taking care of themselves and explaining difficult topics around heart health. Dr. Isang, anything else you'd like everyone to know about you and your background?
Yeah, for most of the people who don't know, Dr. Isang, I was originally born in Nigeria and moved to America when I was 6 years old. And my dream, probably when I was around 14, 15, was to end up playing football in the NFL. And that came, to a tragic end in 2001 with a leg injury. And ever since then, it was my dream to always be able to help people because of the orthopedic surgeon who helped me. So from there, I kind of knew I wanted to be a doctor, and it took a few more years to realize which type of doctor that I wanted to be. And I was grateful to be able to come back to my home program to complete my cardiology, internal medicine residency, and then cardiology fellowship. And now I've been out practicing for 2 years now. So I'm super excited. And to kind of summarize it as prevention is the most important thing that we can do for our patients and for ourselves, and just understanding that prevention is a lot cheaper, a lot better, financially healthier than treatment. So if there's one thing that I want people to know me for, is the importance of just preventing heart disease itself.
I love it. And definitely, let's talk about that, right? Heart disease in America is epidemic, right? The last statistics I've saw from the CDC, they said 45% of U.S. adults have uncontrolled high blood pressure, right? This includes 37 million adults, which and additionally, it's around 19 million who should be taking medication for hypertension are not taking it because they just don't know it. And so this is something that we're seeing in our role where we help monitor patients at home with blood pressure cuffs. This is something becoming more and more prevalent. So what is your understanding of heart disease in America, and what are some of the things that you're seeing that can help turn the tide around from this epidemic?
I think the biggest thing that I'm seeing is that linking to hypertension, it's also known as a silent killer. People are going to come to the hospital if they have a wound in their leg, if they have a cut, if they have a cold. They're not going to come to the hospital if they don't have any symptoms from high blood pressure. So that's in two factors. There are people who know that they have high blood pressure, but they don't have any symptoms. So they leave it alone for many years, decades, until something bad happens. And that something bad will be a heart attack, it'll be a stroke, it'll be heart failure. It's always interesting because you'll see the family members say, he's been healthy his whole life. He really hasn't. He's been compensating his whole life until the big event happened. Those are the people who know it. And then secondly, if you don't have symptoms of hypertension, a lot of people don't know that they have high blood pressure. It wasn't until I was 28, 29 years old that I finally checked my blood pressure, and because I was always blaming it on anxiety or blaming it on stress, but my blood pressure was consistently over 130. Over 140 at times. And for mine, a lot of it was genetics. My parents have high blood pressure, so I was a lot skinnier and still had high blood pressure. So understanding that you don't have symptoms with high blood pressure, typically you can have headaches at times, but if you don't get it treated, you do feel good now. But for a lot of people, unfortunately, they eventually come to the hospital due to a cardiac event or due to a stroke, and a lot of it is due to high blood pressure.
As a medical professional that works with large organization and obviously has to understand how to create policies, right, to help patients understand that, what do you think healthcare organizations can do to create this silent killer, as you would name it?
To help treat it?
Yeah, to help treat it, but also to make patients more aware of
Yeah.
how
Yeah.
they can,
Absolutely.
maneuver.
And the biggest word is going to be outreach. Outreach is going to be the most important thing that we do, especially outreach to organizations or groups that don't have the access to it, low income houses. But outreach is the biggest one. That's the one thing that we preach the most, because once again, people don't know that they have high blood pressure, or they don't know what high blood pressure can lead to. So you have outreach to help educate people, but also you have to have outreach to help provide care for these people who can't afford to go to the hospital too. And then the third stage, I think that's the biggest one, is actually outreach to educate the younger individuals, educating people in their 20s so that they can watch out for it and they can educate their younger siblings or even their children, start them off at a healthier life. Stop reaching for the fast foods and make your own foods, and doing those small tasks over time to not only prevent them from having heart disease, but also to prevent their loved ones and their close family friends.
I like what you said, just thinking about the younger generation, because creating that behavioral, right,
Mhm.
at an earlier stage, right, to kind of get the skills you need now so it becomes second nature to kind of prevent things that can happen worse later on. So let's pivot a little bit. Like we talked about, you're out there in social media, massive following. Do you feel like doctors should be on social media? Is that part of that outreach strategy in your mind, make patients aware of how to
Mhm.
take care of their health?
Yeah, I think doctors should at least consider it. Social media is not for everybody, and it's very complex too. So, in one sense, you probably can and not even have to show your face, because I think the biggest fear is imposter syndrome. That's one of my biggest fears too, is how I look in front of other people. And there are just some people who don't want to utilize social media in that aspect, but they can create content that just provides educational resources. So, in one way or another, we should do a better job, because I see brand new patients 30 minutes and returning patients 15 minutes. With social media, with a post, I can reach viral posts 1 million people. So you can touch the lives of so many different people within 10 to 15 seconds via social media. So I think in one way or another, we should be utilizing it more. There are going to be some people who want to be the face of the social media. Some people just want to be the text, but in one way or another, we should be utilizing it more and just trying to educate people, because as much as I'm telling people to exercise and watch what you're eating and don't smoke, you have the tobacco industry that's pushing something else. You have the fast food industry that's pushing something else. So the only way that we can fight is just to push as much, if not even more than they are.
We tell our doctors that we work with, it's imperative to kind of get your message out there, not just for awareness, but also branding, and also to help you communicate, some of your insights and utilize these platforms, right? They're free, right? But to your
Mhm.
point, because they're free, they're not
Yeah.
easy, right? And being consistent to utilize it. Just curious, what made you start down this path to get into social media? What was your impetus? I talk to a lot of doctors all the time, and a lot of them, they just feel like they have no time, right? They got to see patients. They're independent. They have to run their practices. What made you flip the script and say, hey, I'm just going to be dedicated to making this something that's part of who I am?
It was one of those things where people were asking me the same questions over and over. What's causing my palpitations? What's a good blood pressure number? I think the biggest one is, people love the word reverse. How can I reverse heart disease? So instead of answering 20 million people the same question, why not create content that you can just say, hey, go look at this. I've talked about this extensively, and this is what you need to look out for.
I love it. And how's that help with just exposure? Do you feel like that's helping you get your message out, but also expose you to new opportunities that you didn't see happen before by being on social media?
I think absolutely. I think one of the best cases is this one person that I met on social media. She goes out of her way to message me at least once a year, because she had actually had high blood pressure and nobody could figure out why, but she was just being okay with it. I think I made a post about other potential causes of high blood pressure, to look at the kidney arteries, look at the adrenals, look at hormones, and she actually did it and actually had a blockage in her kidney artery that ended up putting in a stent and opening it up. And basically she went from being on 4 medications for high blood pressure to just being on one. So the message is heard. And I think over the years, I think I really went hard in 2019, now in 2022. So it's been a couple of years, and it opens up to new opportunities such as this one too, which I was very excited, because I've been doing the same thing consistently for the past few years. And I've always been thinking about, what can I do next? How can I provide more care, or how can I expose these health conditions more? And the more you post, the more you're present, the more opportunities that you're given.
How much time do you feel like it takes out of your day, or your week? Are you spending like an hour at a time? a week to kind of get this out? Do you have a team? If you're talking to like your colleague and saying, hey, how do I start with social media?
It's a team of one right now. And I think that's where I'm going to need to pivot eventually because it becomes a lot. But it's also easy because one of the things that I have is a book of just topics. And whenever I get an inspiration, I just write it down. Or if I see someone who's made a message one way, I'll flip it to something cardiac or health related. So I probably utilize about 45 minutes a day on it. I'm trying to be able to scale that down more. I think the best way to be able to do it is just put out a time where I can just do everything all at once and then schedule the post to be made automatically. But I'm not in that phase yet. I should be, but I just haven't pulled the trigger yet.
Yeah, definitely. I mean, consistency is key. We saw explosion of doctor influencers, right, during the pandemic. And that was helpful, right, because it was an unknown time and something that we've never seen before, worldwide pandemic. I've seen some doctors take a step back a little bit from that, but now is even more important because a lot of these other voices, right, that are not medically trained, right, are speaking out and giving their opinions. And we saw during the pandemic, a lot of misinformation went out there. And so I'm encouraging other doctors, and we do help them also with social media as well, because that is so key to get your name out there, communicate and bring value. And to your point, just a hesitation, even I was hesitating. I started just 2 years ago. I'm not a medical doctor, but I'm a business person, but it's always that first step to do it. Once you get used to it, to your point, I got all these ideas, I can put them out and ways to communicate the value out there. And I think that's so important.
One of the things that I found, or the setbacks or the roadblocks is my own thoughts. I think I'm not going to post this. I'm not the right authority figure for it. But then when I post something about something similar and then somebody gets good knowledge from it, they'll message me. It's like, thank you for posting this. I've sent this to my husband for him to go get looked. So I feel like what I feel about what other people feel about me is what I internally feel about myself. So I need to just get over that hurdle and just press record.
Everyone has their own perception of reality, but it's really not reality, right? It's just what your perception is. And so to your point, you just get over that and just do it. Like I said, I've gotten flamed before on the internet, and I told my team, don't worry about it. It is what it is. And we'll just keep moving. So you just put the information out there and try to help as many people as you can with a good intention and heart also work out. So yeah, that's great advice, definitely, for a lot of medical professionals that I talk to, and the importance of doing it. Because I think this is the new way of just communicating with people now. I grew up in a generation where you just talk to people one-on-one, had conversations. But now, even I notice myself, I'll watch someone's content, then I'll go down a rabbit hole and I say, why he's good. And eventually I'll come back and reach out to them, right? It may have been like months later. All that time I've been listening to their philosophies, their understandings. And I said, a lot of stuff he's talking about, something I agree with, just like that young lady you mentioned. I bet she was probably following you for months or weeks before she actually reached out, right? And then
absolutely,
you have helped her so much that now she's reaching out every so often. I mean, you're almost like a trusted advisor at that point. So I think that's really important. So let's talk about the connection of healthcare, and you talk about physical health. You were a football player. When you kind of talk about that, the younger generation are just doing outreach. What are some of the key things that doctors can tell their patients to stay healthy around their heart? Obviously, there's the standard 30 minutes of walking and eating healthy. But are there three simple things that doctors can just take every time, whether they're primary care or, a specialist? What are the things you feel like are easy for people to assimilate and do?
People are unhealthy for several reasons, or there are several things that they're putting into their bodies that's leading to them not being healthy. They're eating excess calories, they're drinking excess alcohol, they're smoking. So for me to tell them to just stop everything for your heart, which they should, I start to emphasize choosing one thing at a time, because it's going to be hard for them to break every single habit all at once. But if they can find one, break that, or get close to breaking that, and then get into the next. And even with nutrition, if they're having those late night snacks, you just got to cut it out or switch to something else, more protein and less processed. Just finding one thing that they can do to get the results that they want, but also understanding that it didn't take one day for you to be in horrible shape. It took consistency in making the wrong choices. And with that, you're going to need the same consistency in making the right choices. I was the biggest example for my own self, because I was trying to lose weight and I would put in 30 minutes to sometimes even an hour but I would only do that one every 2 weeks. And I was just burning myself out trying to lose weight in a short period of time. But I put myself in a test saying that I was only going to work out for 15 minutes every single day, but I would do it every single day. And when I did that, in a span of about 6 to 7 months, I lost 20 pounds. That was my goal. I didn't want to lose that much weight because I didn't need to, but I wanted to show myself that it's possible. You know, the guidelines are 30 minutes, but if you can only allocate 15 minutes, that's pretty much all what you need. That with just monitoring what you're eating and monitoring when you're eating. A lot of people are having a snack and then an hour later having a snack and then an hour later having another snack. Yes, it's not that many calories, but you're spiking up your insulin levels, which is good for removing the glucose out of the body, but does have detrimental aspects in regards to calcium buildup, plaque buildup, and heart disease. So just understanding those small steps and being consistent can make big changes, but you have to give yourself time.
Yeah. There's research in that area where they talk about like building a habit and staying consistent. And like you said, those small things that you can do every day. And then I'd play tricks on myself. I try to do push-ups every day. It's one day. That's it. Not 2 days in a row. So I try to be consistent with that every day. You know, to your point, it does build a sense of stableness, but also, like you said, I see more strength. I can do more. I can only do maybe 40 at a time. Now I'm doing way more now. So I'm like, hey, listen, I've been doing it for about 3 months, pretty consistent. So I agree. I think that's the key to consistency to that factor. Like you mentioned, you were a football player. I played basketball. You did your 2-a-days, right? When you were younger and went all out. And I was doing my suicides. Back then, it was a lot easier. But yeah, as you get older, trying to figure out those consistencies. And if you don't have 15 minutes, then you don't have a life. So you can do 15 minutes. So I like that aspect of it. So when you do speaking engagements or you go out and outreach, what are some activities you see that work well when you're trying to reach out to the populace to talk to them? Outside of, social media helps, but like when you're in your area there in Tennessee, how are you kind of reaching out to individuals to talk about these things?
Usually we'll have an event, but I think the event that works the best or the way that people are engaged the best is just an open-ended conversation where I find one topic and we talk about hypertension and kidney disease. But I only talk about that for like maybe 5 to 10 minutes, but the event is open for 30 minutes to an hour. So people are just, whatever questions is bothering them, and sometimes goes out of the scope of the point of the talk, but still giving people just the opportunity to ask any questions and all questions possible. I do find that when we have events, the ones that people show up the most is the ones that you're being able to, you have to give them a freebie. So the freebie is free glucose scanning or checking the blood pressure. And when you utilize that, you give them what they want to be able to provide them what they need.
Yeah. And I think that's marketing 101. You definitely have to give people something, help them before you help them, kind of in a sense, right? Hey, here's something free to help you, check your blood pressure or your glucose. Oh, by the way, there's more help here that you can get as you kind of enter into that. So we see that a lot as well. When you think about the future of some of the innovations that are happening in technology, what are you most excited about when it comes to like cardiovascular health? There's preventive things that we can do. But when you look at medicine and where it's going, not just with medications, if you want to talk about that, or technology itself, like I mentioned, we do a lot with remote blood pressure monitoring. We both are sports guys. People don't pay attention unless you keep score. Blood pressure, people are checking their blood pressure every day. So, oh man, dip down, what I need to do, So what are your thoughts about like innovation and technology and how that can help change the tide toward better heart health?
I think the best way to answer that is with a patient that I just had. So I was seeing her for the past 3 months she was having abnormal heart palpitations, skip beats, and we couldn't figure it out. So I put her for a heart monitor for 7 days. I couldn't capture it. So I felt good that I was going to capture it in 30 days. Still couldn't capture it. And I remembered that I have a device called a CardioMobile, which is basically an EKG that you have at home. It's about this big and you put your fingers down on it and it'll give you an EKG at that time. And I think within 2 months of her buying that, she was having the symptoms again. Thankfully, she was awake. And then we were able to find the abnormal heart rhythm that she had called SVT. From that, I was able to send her to one of my partners who does an ablation to basically potentially get rid of it permanently. So if it wasn't for her getting that CardioMobile, we probably would have never been able to diagnose what her symptoms, what her issues were. So it's pretty awesome that, in the past, to be able to get an EKG, you had to come to the hospital, they had to put all these electrodes on you. It was frustrating. They would leave some on you and you would find them when you were taking showers. But now at home, you can basically get your own EKG. You can actually save it and you can send it to your doctor and they can make medical decisions based on that.
Yeah, we're seeing obviously the advent of artificial intelligence become more relevant. And so it's still early days, clinical decisions with it, but in certain cases, looking at data sets, radiology is being able to find things better than a radiologist, right? And so to your point, the data, capturing it at where the patient lives, and then being able to kind of utilize the data to find trends can really help be an assist to the doctor. So I could definitely see technology with artificial intelligence embedded, assisting you in making those decisions faster, right? And saying, hey, based on the data, because from my understanding, you guys do a lot of case study work in medical school, right? So your percentage of a 75-year-old man who has this type of condition, he's going to have X. Right. Based on statistics. Right. And so that's what artificial intelligence can do to kind of help accelerate that. So we're seeing more of that.
There's some softwares that are tracking your age, risk factors, and your EKG. And from that EKG, they can predict if you're going to have heart disease in the future.
So definitely, these are some of the great things that are happening. So this is great, Dr. Yusang. I think this is insightful for how to communicate these type of things for patients, but also for doctors themselves to kind of take to heart. And we talked to a lot of medical practices, and this is kind of what this podcast is really about, to educate them on ways to communicate to their patients, but also to put themselves out there with their expertise. So what's next for you? What do you have out there, or anything you want to communicate and promote?
Nothing yet. I think eventually, what better way to help people, especially people of color who look like me, than to tell my story in the form of a book, the obstacles going through from football to football injury to becoming a doctor. So that's one of the things that I want to do eventually hopefully within the next year. Like I mentioned before, I think 2 or 3 years ago, I wrote an ebook to just kind of help people with the 7 most common questions people ask me regarding high blood pressure, palpitations, chest pain, heart disease, and prevention. But the biggest one is just educating people on all platforms.
I love it. Yeah, definitely. If you have it, send us a link and we'll put it in the show notes so people can get a copy of that for their own usage. Dr. Yusang, thank you for your time. Appreciate it, everyone. Thank you for listening to the latest podcast on how you can talk to your patients more, help you grow your medical practice, and understand the latest innovations and technologies and ways to communicate out there in the new health normal. So what's going on in healthcare. So thank you for your time, sir. You have a great one.
Absolutely. Thank you.